Hello my dear friends, this is Vijita, NCLEX-RN trainers at Athena Coaching Center. In this video, I am going to discuss a medical procedure, bone marrow aspiration. This is usually performed in a patient who are having hematological condition and oncology conditions. Here we use a thin needle to aspirate the bone marrow for the diagnostic purpose as well as for the therapeutic purpose. Now we'll discuss what all are the purposes. Usually to diagnose leukemia, lymphomas and multiple myeloma. Additional to this, to evaluate the treatment for multiple cancers as well as to identify the progress of the disease, and for harvesting bone marrow, usually we perform this procedure. For your nursing licensing exam, basically for NCLEX-RN exam, you will get number of questions from the nursing management when we perform any medical procedures. This is performed by a well-experienced healthcare provider. So since this is a procedure, we have to remember what all are the preparations, intra-preparations and what all are the aftercare. Before this procedure, since this is an invasive procedure, we have to take consent. Basic vital parameters has to be assessed. Definitely yes, explanation is very important. Since this is an invasive procedure, and in the earlier I said this is performed in a hematology conditions as well as oncology patients, so bleeding tendencies are high. So we have to evaluate we have to assess the blood components like coagulation profile study. It is really important. This is an invasive procedure and it causes pain, so local anesthesia will be given for the patient. Now, how this procedure is performed? Number one step is position. Usually bone marrow aspiration will be performed, or it is done at an iliac crest, or it can be performed at sternum as well. Based on that, the position varies. Usually, we allow the person to lie down on their abdomen or on their side. That means either lateral position or prone position can be given for this procedure. We have to clean the area and drape with a sterile hall towel. And we need to give local anesthesia. And after giving local anesthesia, take a thin needle and identify the bone marrow aspiration spaces and then insert the needle and aspirate the sample. Once you get the adequate sample, then collect in a container and then label it, then send for evaluation and analysis or for a laboratory works. As soon as you receive the sample, it is very important to transport immediately. Never keep the sample for a long time. After the procedure, we have to comfort the patient. Patient will be having pain, so over-the-counter pain medications can be given. So that will always help the patient to be pain-free and the comfortable. Patient will become comfortable. Now, we have to check the site for bleeding, and very rare complication is infection later on, but we don't expect that. And as in the beginning itself I have mentioned this is performed, this particular procedure is performed by an experienced person, so we never expect any of complications such as damage to nearby structures, but definitely yes, that can also be considered as a complication. Remember, for any of our procedure, we don't prefer or we don't really expect complication. We have to work very hard to avoid a complication. That is the reason why we need to be competent enough to perform procedures. If you are not competent enough, definitely you are putting the patient in a harm. So never ever put the patient in a harm. These are the basic cares: aftercare, intra-procedure care and pre-procedure care. Now, We have to remember each and every point, and when you get questions from this particular area, you can answer effectively. If you have any doubts, please put your doubts in the chat box. Thank you for watching. God bless you all.